Hello, good day everyone. We are again the group 2 from DDC BSN 111F, and for this video, we are going to tackle about our worksheet 3 or the musculoskeletal system. So without further ado, let's start to the reporting. First up, we have Miss Felicity Di Carlos to discuss the overview of the skeleton.
Good morning, everyone. I am Felicity Di Carlos, and I will be tackling about the bone markings. Number one, sharp and slender process. Our answer is spine. Number two, small rounded projection. This is the tubercle. Number three, large rounded projection, the tuberosity. Number four, structure supported on neck. This is the head. Number 5, the arm-like projection. This is the ramus. Number 6, the rounded convex projection. This is the condyle. Number 7, canal-like structure, the meatus. Number 8, round or oval opening through a bone. This is the foramen. Number 9, the shallow depression. This is the fossa. Number 10, the air-filled cavity, sinus. Number 11, the large irregular shape projection. This is the trochanter. So let's move on to the number 2. The four major anatomical classifications of bones are long, short, flat, and irregular. Which category has the least amount of spongy bone relative to its total volume? So our answer is the long bone has the least amount of spongy bone relative to its total volume. The long bones are typically longer than they are wide, thus they have a small shaft with enlarged ends, and these shafts have large amounts of mineralized compact bones, which while the spongy bone only appears at the ends of the long bones. Number 3, classify each of the following bones. So the humerus and the phalanx are categorized to the long bones, and the parietal or the skull bones is categorized to the flat bones. The calcaneus is the short bone. The rib is also a flat bone. The vertebra is an irregular bone. Let's go to the gross anatomy of the typical long bone. As you can see on the screen, you can see the proximal epiphysis, the diaphysis, the distal diaphysis, the red marrow, the epiphyseal line, at the center, the medullary cavity. You can see the spongy bone and also the articular cartilage. So you can also see the endosteum, the compact bone, the yellow marrow in the center, and the periosteum. Also, you can see here the compact bone and the periosteum, and at the center you can see the trabeculae of spongy bone. So, made almost entirely of compact bone are the diaphysis. The site of blood cell formation is the red marrow. The fibrous membrane that covers the bone is the periosteum. The scientific name for bone end is the epiphysis. This contains fat in adult bones. This is the medullary cavity. The growth plate remnant is the epiphyseal line. So what differences between compact and spongy bone can be seen within the naked eyes? So the appearance of spongy bone and compact bone to the naked eye only hints at their underlying complexity. Compact bone appears to be very smooth, homogeneous, dense, and thick, while spongy bone is composed of small needle-like pieces of bones and a lot of obvious spiky open spaces that is filled with marrows, blood vessels, and nerves. So number 6. What is the function of the organic matrix in bone? The organic matrix in bone, especially the collagen fibers, is responsible for providing mechanical support for locomotion and great tensile strength or the ability to be stretched without breaking. Number 7. Name the important organic bone component. The important organic bone component in our body are the osteocyte, ground substances, collagen, and lastly the elastic fibers. Number 8. Calcium salts from the bulk of the inorganic material in bone. What is the function of the calcium salts? The calcium salts deposited in the matrix give bone its hardness, which resists compression. Number 9. Which is responsible for bone structure? So our answer is the inorganic portion and the organic portion. So they both contribute. Number 10. Trace the route that nutrients take through a bone, starting with the periosteum and ending with an osteocyte in a lacuna. So the first one is the periosteum, second is the perforating canal, third is the central or Harvestian canal, fourth is the canaculus, fifth is the lacunae, sixth is the osteocyte. Now, let's proceed to the microscopic structure of compact bone. As you can see on the screen, you can visualize the caniculi. Next is the lamellae and the lacunae, the central canal, and lastly, the bone matrix. I'm passing the floor to Debbie Capitan.
Hello, good morning, good day, everyone. So I will be tackling about the eggshell skeleton. For the first question is, the skull is one of the major components of the eggshell skeleton. Name the other two. The other the other two are the vertebral column and the bony thorax. So another follow-up question, what structures does each of three components of the axial skeleton protect? The vertebral column protects the spinal cord. The bony thorax protects the heart, lungs, esophagus, and great vessels of the thorax. And the skull mainly protects the brain. Number 2, define suture. Suture is the interlocking fibrous steel joints between skull bones. Number 3, which one exception the skull bones are joined by sutures? Name the exception. So our answer is the joints between the mandible or the lower jaw and temporal bones. Number 4, what are the four major sutures of the skull and what bones do they connect? First is the sagittal suture or the sagittal suture. These are the two parietal bones. They connect the two parietal bones. Next is the coronal suture. They connect the parietal bone and the frontal bone. Next is the squamous. They connect the parietal bone and the temporal bone. Next is the lambdoid suture that connects the parietal bone and the occipital bone. Number 5, name the 8 bones composing the cranium. So our answers are frontal, occipital, left temporal, right parietal, left parietal, sphenoid, and ethmoid. Number 6, give two possible function of the sinuses. So the sinuses lighten the facial bone in the skull, and it also acts as the resonance chambers for speech. Number 7, what is the orbit? So, orbit in anatomy and physiology, it is the bony socket that contains the eyeball. Number 8, why can the sphenoid bone called the keystone of the cranial floor? So, the sphenoid bone can be called the keystone of the cranial floor because it articulates all of the cranial bones. It forms a the two across the width of the skull. So let's proceed to the other items. Bone forming anterior cranium or the forehead. We also call that the frontal. The cheekbone is the zygomatic. The upper jaw is the maxilla. Number four, the bridge of nose is nasal. Number five, posterior roof or of mouth or answer is palatal. Number six, the bone paired united by the sagittal suture, the parietal. Number seven, site of jugular foramen and carotid canal, the temporal. Eight, contains a saddle that houses pituitary gland, the spheroid. Number nine, has an opening that allows tears to pass, the lacrimal. Number 10, forms most of hard palate, maxilla. 11, superior and medial nasal conchae are part of this bone, the ethmoid. Number 12, site of external auditory meatus, the temporal. Number 13, has greater and lesser wings, the sphenoid. Number 14, its holy plate allows olfactory fibers to pass, ethmoid. Number 15, facial bones that contains the sinus, maxilla. Number 16, its holy plate allows olfactory fibers to pass. Our answers are frontal, sphenoid, and ethmoid. Number 17, its oval shaped protrusions articulate with the atlas. This is the occipital. Number 18, spinal cord passes through a large opening in this bone. So this bone is occipital bone. Number 19, not really a skull bone, that is the hyoid. Number 20, forms the chin, that is the mandible. Number 21, inferior part of nasal septum, the vomer. Number 22, contain alveoli bearing teeth, the maxilla and the mandible. Number 23, burst and upward protrusions called the rooster's comb or the ethmoid. So let's proceed to the bones of the human skull. So as you can see in the screen, we have labeled the human skull. So first, we are going to start with this. This is the nasal bone. Next, the sagittal suture, the coronal suture, the frontal bone, our parietal bone. These are the greater wing of sphenoid. This is the temporal bone. This is the ethmoid bone. This is the lacrimal bone. This is the zygomatic bone or cheekbone. This is our maxilla. This is the alveolar process. This is the mandible. This is the vomer. This is the inferior nasal concha. And this is the middle nasal concha of the ethmoid. So for the questions, number 11, are the same skull bones present in the adult also found in the skull? Our answer is no. Number 12, how does the size of the fetal face compare to its cranium? So at birth and in infancy, the baby's cranium is huge relative to its face. Babies' heads are quite larger compared to their body size. This is because the fontanelles allow the fetal skull to be compressed slightly during birth, and because of its flexibility, it allows the infant's brain to grow during the latter stage of pregnancy and early stage of infancy that is impossible if the cranial bones were fused by sutures that happens to an adult skull. Follow-up question, how does this compare to the adult skull? So the adult skull is smaller compared to the rest of the body, representing only 1/8 of total body length, while the fetal skull is larger compared to the rest of the body, representing 1/4 of the total body length. This increases in size as it grows. So number 13, what are the outward clinical projections in some of the fetal cranial bones? They are areas of active ossification or the growth centers of the bone. Number four, what is a fontanelle? Fontanelle is a fibrous membrane that is not fully ossified, which connects to the cranial bones. It also means little fountain because these are the soft spots where you can feel the rhythm of the baby's pulse. A follow-up question, what is its fate? So, the fate of fontanelle will be gradually converted to bone and became cranial suture. The fontanelles usually fully ossify by 2 years of age. Another follow-up question, what is the function of the fontanelles in the fetal skull? So it allows the fetal skull to be compressed slightly during birth And because of its flexibility, it allows the infant's brain to grow during the latter stage of pregnancy and early stage of infancy that is impossible if the cranial bones refuse by sutures that happen to an adult skull. Basically, it allows brain growth and
Nangaan
ease
ni sila
birth
te.
passage. So flashed on your screen are the cranial fontanelles. We have the anterior fontanelle, the sphenoidal fontanelle, frontal bone, the temporal bone, the mastoid fontanelle, the occipital bone, the posterior fontanelle, and the parietal bone. So I am passing now the floor to Miss Sophia Altera Bermejo.
So, proceeding to the vertebral column, our answer for number 1 is letter I, or the vertebral foramen. Our answer for number 2 is letter A, or the body. Our answer for number 3 is ENG, or the spinous process and transverse process. Our answer for number 4 is ANG, or the body and transverse process. Our answer for number 5 is intervertebral foramina. And for the last number is A and H, or the body and vertebral arch. So for the general structure of the vertebrae, as you can see on your screen, letter G is the transverse process, letter F, or the superior articular facet, letter D is the pedicle, letter A is the body, letter I is the vertebral foramen, letter H is the vertebral arch, letter C is the lamina, and last, letter E is the spinous process. So next, for the identification on describing structure or regions, our answer for number 1 is cervical vertebra typical. Number 2 is axis. Number 3 is thoracic vertebra. Number 4 is sacrum. Number 5 is lumbar vertebra. Number 6 is coccyx. Number 7 is atlas. Number 8 is lumbar vertebra. Number 9 is thoracic vertebra. And for the last number, number 10 is sacrum. So, moving on to the types of vertebrae and its structure. So, that is the body, as you can see, and this is the superior articular process. This is the transverse process, and this is the spinous process. So, and also this one is the demifacets, demifacets, and this is the thoracic vertebra. So next is the vertebral foramen and the spinous process. This is the lamina, and this is the superior articular process. This is the transverse process, and this is the body. That's for the cervical vertebra. Okay, moving on to the number 19. So, what kind of tissue makes up the interval disc? So, our answer is the fiber cartilage makes up the interval disc. Number 20, what is the herniated disc? A ruptured slip disc in which a portion of the disc protrudes outwards and occurs when a portion of nucleus pushes through the crack in the annulus. And for the another question for number 20, what problems might it cause? It might cause a pinching of spinal nerves or a compression in the nerves, leading to the pain, numbness, and possibly paralysis. So for the structures of an articulated vertebrae column, this is the atlas, as you can see, and this is the axis. This one is the two thoracic vertebrae. This is the interval disc. This one is the two lumbar vertebrae, and for the last, this is the sacrum. For number 22, the major components of the bony thorax, including the vertebral column, are the ribs and sternum. Number 23 is number 23. What is the general shape of the thoracic cage? It is the inverted cone shape and barrel-like shape. show the region and the landmarks of bony thorax. So as you can see on your screen, this part is what you call the coastal cartilage, and this one is true ribs or the letter G. This one is the false rib or the lower, as you can see on your screen, and letter D is floating ribs. So letter H, as you can see on your screen, this one is what you call the xiphoid process. Yes. And this one is the body. And this one is the manubrium. And it is part of our sternum. So, wait lang. Hala. Okay, so number 25, differentiate true ribs from false ribs. True ribs are the first seven pairs that have their own costal cartilage attachment to the sternum fold. False ribs are the next five pairs indirectly attached or not attached to the sternum. Number 26. What is a floating rib? Floating rib is the last two pairs of false rib that lack sternal attachment and has no costal cartilage. So let's proceed to the appendicular skeleton, which is Miss Wem Crisini.
Thank you, Ms. Bermejo. Hello everyone. My name is Wem Kusini reporting. So our next report is all about the appendicular skeleton. So we have our bones of the pectoral girdle and the upper limb. So first we have our coracoid process, the acromion, the clavicle, the greater tubercle, the subscapular fossa, the scapula, the deltoid tuberosity, humerus, lateral epicondyle, the coronoid fossa, the capitulum, the medial epicondyle, the trochlea, the coronoid process of ulna, the radial tuberosity, the radius, the ulna, styloid process of radius, the styloid process of ulna, the carpals, the metacarpals, and the phalanges. Next, in the next page of our worksheet, which we have our matching type. So our first um, item is number one. It is raised area on the lateral surface of a humerus to which deltoid muscles attaches. So our answer is the deltoid tuberosity. Number two is the arm bone, which is the humerus. Number three, bones of the shoulder girdle, which is the scapula or the clavicle. Number four, our forearm arm bones is the ulnar radius. And then number five is the scapular region, which the clavicle connects. It is the acromion. Next, number six, our next item is shoulder girdle bone that is attached to the axial skeleton, which is the scapula. Number seven, the shoulder girdle bone that articulates and transmits forces to the bony thorax, which is the clavicle. Number eight, the depression in the scapula that articulates with the humerus, which is the glenoid cavity. Next, number nine. Our next question is the process above the glenoid cavity that permits the muscle attachment, which is the coracoid process. And the next one, number 10, is the collarbone, which is the clavicle. Number 11 is the distal condyle of the humerus that articulates with the ulna, which is the trochlea. Next, number 12, it is the medial bone of the forearm in anatomical position, which is the ulna. Number 13, which is the rounded knob that is numerous articulates with the radius, which is the capitulum. Number 14, it is the anterior depression superior to the trochlea that receives part of the ulna, whereas where the forearm, which is the answer is the coronoid fossa. Number 15, our next question, the forearm bone involved in the formation of the elbow joint, which is the ulna. Number 16, the wrist bones, which is the carpals. Number 17, our finger bones, which is the phalanges. And number 18, the heads of these bones from the knuckles is the metacarpals. And number 19, the bones that are articulates with the clavicle, which is the scapula sternum. Next, our next questions are, why is the clavicle at risk to fracture when a person falls on his or her shoulder? So our answer is, it is a lightweight,
Unsay
slender,
Tagalog anang
thin bone that withstands
in
trauma
conclusion te?
poorly. It is the outermost most part of the lax support by muscles and ligaments and
Ha?
transmits force
Ha?
from the pectoral girdle to the sternum,
Kana mo kag
thus easily broken and
therefore
vulnerable to fracture. Next
unsay Tagalog sa
question,
therefore?
number 4, which is the scapula has no direct attachment to the axial skeleton. How does this affect movement of shoulder? So our answer in our group, it is, despite being not attached to the axial skeleton, it is rather held in place and connected to the thorax and vertebral column muscles. Thus, the scapula can move freely across the posterior thoracic wall. Next, number 5, which is, what is the total number of phalanges in our hands? Our answer is 14. 14. Next, number 6, what is the total number of carpals in the wrist? Our answer is 8. Okay. Next, the bones of the pelvic girdle and the lower limbs. So on an item number 7, compare the pectoral and the pelvic girdles in terms of flexibility, range, motion, allowed security, and ability bear weight. So flexibility is, it is, the pectoral girdle is more flexible than the pelvic girdle. The pectoral girdle includes the uh, clavicles and scapulae, and it connects the upper arms to the actual skeleton. There is no anatomical joint between the scapula and the rib cage, but rather a connection made up of muscles and ligaments. This allows for a greater range of mobility and flexibility. Next, security. Security, it is a pelvic girdle is the heavier and more secure than pectoral girdle. The pelvic girdle is more firmly attached to the axial skeleton than the pectoral girdle in order to provide the stability needed to support the weight of the upper body. Next, the weight bearing. It is the pelvic girdle is much better at weight bearing. The bones of the pelvis are securely connected to each other to produce a generally static weight bearing structure, unlike the bones of the pectoral girdle, which are extremely flexible to enhance the range of the upper limb movements. And next item, it is, the question is, what organs are protected at least in part of by the pelvic girdle? So our answer is, the reproduction organs are protected by the pelvic girdle. Number 9, the question is, distinguish true pelvis from false pelvis. So true pelvis in a short curved canal deeper in posterior wall that contains the pelvic inlet and limits the delivery of the baby. False pelvis support that intestines and transmits part of their weight to the anterior walls of the abdomen. Next, our next slide, it is an illustration of coxal bone, which has ilium, iliac crest, anterior superior iliac spine, greater scatic notch, the acetabular, the ischial spine, the ischial tuberosity, the pubis, the ischium, and the obturator for foramen. Next, our last slide, it is the pelvic bones of a four-legged animal, such as a cat or pig, are much less massive than those of human. Make an educated guess as to why is this so. So half of the weight of a four-legged animal will be on their pectoral girdle. Thus, their pelvic girdle can be smaller. All the weight of a human is supported on its pelvis, so it needs to be larger. Next, number 12, our last question. A person instinctively curls over abdominal area in times of danger. Why? So our answer is a person instinctively curls over abdominal area in times of danger to protect all the vital organs in the abdominal cavity. Since there is no bones protecting the abdomen area, there are bones that give support to the abdomen but cannot do anything to protect it. So that is the last part of my slide. I will um, give the floor to Miss Daniela Carrion.
Thank you, Miss Crescini. So let's proceed to number 13. The femur shown is the right member of the two femurs. So as you can see on your screens, this is the head of the femur, neck of femur, lesser trochanter, greater trochanter, intertrochanteric crest, gluteal tuberosity, medial condyle, the intercondylar fossa, and the lateral condyle. Number 14, match the bone names and markings in the key with the leader lines in the figure. The bones are numbered 1 to 11. So number 1 is ilium, number 2 is pubis, number 3 is ischium, number 4 is femur, number 5 is patalia, number 6 is fibula, number 7 is tibia, number 8 is talus, number 9 is calcaneus, number 10 is metatarsals, and number 11 is phalanges. So let's proceed to number 15. Number 1, fuse to form the coxal bone, ilium, ischium, and pubis. Number 2, sit-down bone of the coxal bone, ischium. Number 3, point where the coxal bone join anteriorly, pubic symphysis. Number 4, superior most margin of the coxal bone, iliac crest. 5, deep socket in the coxal bone that receive the head of the thigh bone, acetabulum. Number 6, joint between axial skeleton and the pelvic girdle, sacroiliac joint. Number 7, longest, strongest bone in the body, femur. Number 8, thin lateral leg bone, fibula. Number 9, heavy medial leg bone, tibia. Number 10, bones forming knee joints, femur and tibia. Number 11, point where the patellar ligament attaches, ethmoid. Number 12, kneecap, patelia. Number 13, shin bone, tibia. Number 14, medial ankle projection, medial malleolus. Number 15, lateral projection, lateral malleolus. Number 16, the two largest tarsal bones, talus and calcaneus. Number 17, the ankle bones, tarsals. Number 18, bones forming the instep of the foot, metatarsals. Number 19, opening in hip bone formed by the pubic and ischial ram, obturator foramen. Number 20, sites of the muscle attachment on the proximal femur, the gluteal tuberosity and the greater and lesser trochanters. Number 21, tarsal bones that sit on the calcaneus, talus, weight-bearing bone of the leg, tibia. Number 23, tarsal bone that articulates with the tibia, talus. So let's proceed to the joints and body movements. Number 1, typically allow slight degree of movement, cartilaginous. Number 2, include joints between the vertebral bodies and the pubic symphysis, cartilaginous. Number 3, essentially immovable joints, fibrous. Number 4, sutures are the most remembered examples, fibrous. Number 5, cartilage connects the body portions, cartilaginous. Number 6, have a fibrous articular capsule lined with a
Sa na
synovial
persuasive sa
membrane
Tagalog, te?
surrounding a joint cavity, synovial.
Nakakapangikayan,
All are freely movable or diatrotic, synovial. Number 8, bone regions are united by fibrous connective tissue. fibrous. Number 9, include the hip, knee, elbow, elbow joints. So that is all for my part. So I'm passing the floor to Miss Maria Crichel Castillo.
I am Maria Cristiel Caspilio. I will be reporting joints and body movements, which is the matching type. Number one, joint between most skull bones is suture. Two, joint between the axis and atlas is pivot. Three, hip joints is ball and socket. Four, joint between forearm and bones and wrist is condylar. 5. Elbow is hinge. 6. Interphalangeal joints is hinge. Intercarpal joints gliding. Joints between the skull and vertebral column is condylar. Joints between proximal phalanges and metacarpal bones is condylar. 10 is multi-axial joint is ball and socket. 3. What characteristics do all joints have in common? Our answer is all joints consist of bony regions separated by fibrous or cartilaginous connective tissues. Ligament is a dense connective tissue made out of fascia that connects one bone to another and helps stabilizing joints during movement. Articular cartilage is a hyaline cartilage that reduces friction where bones articulate and allows gliding motion. Synovial membrane is a loose connective tissue that produces synovial fluid which lubricated the joint and reduces friction within the joint capsule. Bursa is a fluid-filled synovial sac which cushions the tendon where it crosses the bone. 4. Describe the structure and function of the following structures or tissues in relation to synovial joint and label the structure indicated by the leader lines in the diagram. As you can see in the picture, this is the periosteum, the ligament, synovial cavity containing synovial fluid, articular cartilage, articular capsule, synovial membrane. Which joint, which joint, the hip or the knee is more stable? The hip is more stable between the hand of the femur and the acetabulum of the hip bone. The hip joint is a multi-axial ball and socket joint linked because the hip bears the body weight. It must be strong and stable whether standing or walking. Name two important factors that contribute to the stability of the hip joint. Our answer is deep socket for femur and strongly reinforced articular capsule. Next. 6. During muscle contraction, the insertion moves toward the origin. Number 7 is the body movements. Flexion at the elbow. Extension at the knee. C. Abduction of the upper limb. D. Adduction of the lower limb. E. Circumduction of the upper limb. F. Inversion of the foot. G is rotation of the head and pronation of the forearm. Next. What structural joint changes are common in older people? Degenerative changes, such as adhesions and bone spurs, begin to form in diathoracic joints and intervertebral discs begin to degenerate. These changes lead to increased joint stiffness and pain. Define dislocation. dislocation is the bones are forced out of their normal position in the joint cavity. Next, gross anatomy of the muscle system. Muscle of the head and neck. As you can see in the picture, this is the frontalis, the occipitalis, masseter, platysma, uh, orbicularis oris, buccinator, zygomaticus, orbicularis oculi. I am passing the floor to Mr. Faisal Bayani.
Hello everyone, my name is Faisal S. Bayani. So for the number one, used to green, our answer is zygomaticus. Number two, muscle used during whistling, vaccinator. Used in blinking and squeezing, orbicularis oculi. Number four, its contraction makes the sad clown face, platysma. Then for number five, raise your eyebrows for a questioning expression. Our answer is frontalis. Number six, your kisser. Our answer is orbicularis. Number seven, allows you
Wow,
to bite that
ano po ano
carrot
eh?
stick. Masseter. Number eight, tenses skin of the neck during shaving. Our answer is platysma. Next is muscle of the trunk and upper limb. Number one, a major spine flexor. Our answer is rectus abdominis. Number two, prime mover for pulling the arm posteriorly. Our answer is latissimus dorsi. Number three, elbow extender. Our answer is triceps brachii. Number four, help form the abdominal
Tang ina,
girdle.
inuntab daw.
Our answer is internal oblique, external oblique, rectus abdominis, and transversus abdominis. Number five, extends and adducts wrist, extensor carpi ulnaris. Number six, allows you to raise your arm laterally. Our answer is deltoid. Number seven, shoulder adductors. Our answers are pectorals major and latissimus dorsi. Number eight, flexes elbow, supinates the forearm. Our answer is biceps brachii. Number nine, small muscles between the ribs. Our answer is external intercostals. Number 10 extends the head. Our answer is trapezius. Number 11 extends the spine. Our answer is erector spinae. Number 12 extends and abducts the wrist. Our answer is extensor carpi radialis. Next is muscles of the lower limb. Number 1, lateral compartment muscle that plantar flexes and everts the ankle. Our answer is fibular longus. Number 2, form the buttock, gluteus maximus. Number 3, a prime mover of ankle plantar flexion, gastrocnemius. 4, a prime mover of ankle dorsiflexion, tibialis anterior. Number 5, allow you to grip a horse's back with your thigh, vastus muscles. Number 6, muscles that insert into the tibia, tuberosity. Our answer is semitendinosus and semimembranous. Number 7, muscles that extend thigh and flex knee. Bicep femoris, semitendinosus, semimembranous. Number 8, prime mover of inversion of the foot. Tibialis posterior, 9. Prime mover of reflection of the foot. Dorsiflexion of the tibialis anterior. Number 10, adduct the thigh as when standing at attention, adductor group. Number 11, extend the toes, extensor digitarium longus. Number 12, extend knee and flexes thigh, rectus femoris. Number 13, used to extend the knee while climbing to the stairs, gluteus maximus. Number 14, prime movers of the plantar section of the foot, gastrocnemius. Muscles description. Number 1, deltoid vastus lateralis and gluteus maximus are commonly used for intramuscular injections. Number 2, the insertion tendon of the quadriceps group contains a large sesamoid bone, the patella. Number 3, the gastrocnemius and soleus muscles insert in common into the calcaneal tendon. The bulk of the tissue of a muscle tends to lie proximal to the part of the body it causes to move. Number 5, the extrinsic muscles of the hand originate on the forearm. Number 6, most flexor muscles are located on the anterior aspect of the body. Most extensors are located posterior. An exception to this generalization is the extensor flexor musculature of the knee.
So for the general review, the muscle recognition, number 1, letter T is the orbicularis oris, letter V is the pectoralis major, the external oblique is X, the sternocleidomastoid is letter U, the biceps brachii is the G, deltoid is letter E, the vastus lateralis is L, the frontalis is Q, the rectus femoris is K, the rectus abdominis is W, the sartorius is double A, the platysma is C, the flexor carpi radialis is letter I, the orbicularis oculi is letter R, the gastrocnemius is the double C, letter B is our masseter, letter D is our trapezius, letter P is the tibialis anterior, letter double B is the adductors, letter M is vastus medialis, letter Z is the transversus abdominis, letter N is fibularis longus, letter J is iliopsoas, letter A is temporalis, letter S is zygomaticus, letter F is triceps brachii, letter H is brachialis, letter O is the extensor digitorum longus, letter Y is the internal oblique, letter double B is the soleus. Letter N is the gluteus maximus, letter R is the semimembraneus, letter F is the gastrocnemius, letter K is latissimus dorsi, letter J is deltoid, letter Q is semitendinosus, letter I is trapezius, letter P is biceps femoris, letter A is triceps brachii, letter L is external oblique. While the gluteus medius is letter M, the flexor carpi ulnaris is letter C, the extensor carpi ulnaris is letter D, the extensor digitorum is letter E, the extensor carpi radialis is letter B, and the sternocleidomastoid is letter H, the adductor magnus is letter O, and the soleus is letter G. So that's it for the muscle recognition. Now we will proceed to our last deep dive for this worksheet, and it is the execution of the movements. So to be flashed on your screen are the different movements that was instructed at the worksheet. For number 1, we have the flexion and extension of the shoulder. Flexion and extension are movements that occur in the sagittal plane. And we also have the flexion and extension of the knee. This flexion and extension refer to the decreasing and increasing angle between two body parts. For number 2, we decreases the angle between two body parts. We also have the extension that refers to a movement that increases the angle between two body parts. Lastly, the hyperextension, which means that there has been excessive movement of a joint in one direction. In other words, the joint has been forced to move beyond its normal range of motion.
这一次我真的睡着了。
For number 3, we have the rotation of the head. So rotation just basically means to rotate. And we also have the rotation of the lower limb. Number 4, we have the abduction and adduction motion that occurs within the terminal plane and involves the lateral movement. We also have the circumduction, which is the orderly combination of shoulder movement so that the hand chases a circle and the arm chases a cone. Number 5, we have the dorsiflexion or the backward bending and contracting of your hand or your foot. Next, we have the plantar extension that refers to the movement of the foot in a downward motion away from the body. For number 6, we have the inversion and eversion. Inversion involves the movement of the sole towards the medial plane, while the eversion involves the movement of the sole away from the medial plane. The last item, we have the supination and pronation, which are the terms used to describe the up or down orientation of your hand, arm, or foot. So that's it for our reporting for today. We hope that you've learned something from our report and that you can apply this to your lives. Once again, we are the group 2 from the SN111 at Davao Doctors College. Thank you for staying, listening, and watching. Until next time, goodbye and have a great day.